Perfect. And I'm gonna stop the poll now. It looks like we have just about everybody. There's one more person if anybody's there. One more person. It's anonymous, so no worries. All right, awesome. We're gonna end that. And I'll pass it back to you, Nisha.
So it seems like we have about one person who is a self-advocate. We have 2 people who identify as a caregiver. We have 18 individuals that are professional providers. And we have 1 member that is a community member, and we have 10 disability allies. And I love to see that. So just some housekeeping tips. This session is being recorded, so the recording and PowerPoint will be made available to anyone who needs it. And anyone that needs CEUs, we will be providing a survey at the end of the session. So as soon as you fill that out, we can provide you with the CEU certificates. And captions are made available within Zoom by just clicking show subtitles or CC or transcript. It should be shown at the bottom of your screen. And once you show that, you can actually move the captions around so they don't get in the way of the PowerPoint. And if you are not actively speaking, please mute your microphone and feel free to utilize the chat box to message Alexa and I, with Alexa and Nisha, with any questions that you want or want to have answered. We limited the chat box to be just me and Alexa, just to keep it accessible, because anyone that's utilizing a screen reader, it may be a little bit noisy in the chat. So any questions you have, please feel free to ask either one of us. And to ensure accessibility, please state your name when speaking. All right. So today's First Health Equity Roundtable will focus on the COVID-19 vaccine, and throughout this presentation, we'll be providing you with statistics regarding the vaccine on Staten Island and how many people are vaccinated. However, we will be specifically focusing on vaccine hesitancy amongst IDD providers and groups to understand and to educate individuals on the vaccine and the importance of the vaccine. So we will be focusing on the COVID-19 vaccine, the precautions, and really a call for action. We will be meeting in breakout rooms with our panelists, who you'll be meeting soon, just to discuss these are the impacts of the vaccine. So now what? How can we maneuver through the impacts? What can we do to ensure that individuals with disabilities, that are caregivers, DSPs, aren't left behind in the conversation, that they are in fact in the forefront of the conversation? And so just a quick rundown of our agenda. The Executive Director of PCCS, Chris Marchione, will be introducing our panelists. We are going to be discussing, again, the COVID-19 stats and hesitancy among Staten Island groups. And we will be breaking out in breakout rooms so you guys have an opportunity to interact with our panelists. And again, we're going to meet at the end, come full circle, and discuss how can we help this community and this population. So I am going to pass it over to Chris so she can go ahead and introduce our panelists.
Hi, good afternoon, everyone. It's Chris Marchione. I am a white person with shoulder length, dark, wavy hair. I'm wearing glasses today and a gray sweatshirt. And behind me, my virtual background says nothing about us without us. Today, I'm very excited and happy and honored that our guests are here and they're joining us, and they're going to share a lot of information, share their wisdom and their experiences, which, with this pandemic over the past year, and hopefully, shed some light, answer your questions, and give us some hope for the future. So today we have Megan Hamway from the New York City Department of Health and Mental Hygiene. We also have Jenny Sutcliffe from the New York City Department of Health and Mental Hygiene. We have Dr. Vincent Siosoka from Montefiore Hospital. We have Michael Weinberg, who's the Vice President of Residential Services. I think I got that right, Michael? Over at AHRC. We have Dr. Fred Wetzel, who I think I know you, Fred, for now, oh gosh, I think it's over 30 years, or maybe a little less than 30 years, maybe like 28. Welcome, Fred. And we have Jill Cornell from the New York City Office of Emergency Management. And Sam Lawson, I believe you're also from the New York City Office of Emergency Management. Isn't that right? And Sam, we met, I think it was 2 years ago when you did a presentation with one of your colleagues, Matt, over at the Staten Island Developmental Disabilities Council on Emergency Preparedness.
Yes.
Unfortunately, I don't think Dr. Ginny Mantello is able to join us today. I don't see her on the call. If she does join us, we'll come back and go from there. I will hand it back to you, Nisha. Welcome. Oh, I forgot one more person. How can I forget? I just saw him this morning. We also have Assemblymember Michael Cusick here, who has been meeting with myself and my colleagues from the Staten Island Developmental Disabilities Council every Wednesday morning at 9 a.m. To talk about this crisis with the pandemic, plus also budgetary issues that are going on with people, receiving supports and services, people who are developmentally disabled, and how that on top of the pandemic is impacting the lives of thousands, hundreds of thousands of people across this state. And Mike, actually, he's the one who came up with the idea to meet every Wednesday. And we're so thankful to meet with him. I'm grateful. And his staff does amazing things. Tom and Jackie, they're just great. So thanks everyone for being here and joining us. And now I'm going to hand it back to Nisha.
Thank you for that, Chris. So just to get started, I will be providing all the fun facts and statistics about Staten Island. So Staten Island is comprised of 476,143 Staten Island residents. And of those, only 49% have at least one vaccine, COVID-19 vaccine dose, and 44% of Staten Island residents are fully vaccinated. And as of June 16th, 2021, approximately 51% of Staten Islanders are not vaccinated. So that's more than, so I know yesterday everyone was very excited because 70% of New York State is vaccinated, and that's amazing, that's great, but that leaves room for Staten Island. Why are only 49% of Staten Islanders vaccinated, and what can we do to deal with that? So I have some questions for you guys. What are some, if you guys can unmute yourselves, what are some reasons that other zip codes are vaccinated versus others? What are some reasons that people may go ahead and get vaccinated, whereas others would not?
So Nisha, I don't know if anybody wants to jump in, but I'm going to
Sure.
throw in my other hat as a teacher at the College of Staten Island, and we talk about the demographics here on Staten Island. And if I remember correctly, the zip codes, we have sort of a one pocket in the North Shore and another one that's maybe Tottenville, very south. So it's interesting that we have very low rates of vaccination in two extreme demographic populations for Staten Island. And when I was thinking about today's presentation, the one thing is like, well, what do they both have in common? And there could be just historically maybe in one group and maybe more recently for another, if you were to break down things politically in demographics, not just in socioeconomic terms, but also politically, there sort of is this historic distrust, if you will, maybe of government as well as the medical establishment. That would be something I would love to delve into, my sociological hat going on to look at. But you do have these two big pockets of very low vaccination rates. The rest of Staten Island, I think we could talk basically same things, maybe socioeconomic and trusting of the political system, the media, as well as the medical system historically by certain groups of people.
Yep, and we're definitely going to go into the statistics regarding that. And I see someone mentioned, Mindy, you messaged me in the chat, lack of trust in the government and Black and brown community hesitancy, definitely. Yeah. Does anyone else want to share?
It's Fred. I think that the other issue was, of course, the ongoing spreading of rumors over the internet and spreading of mythology over the internet, especially by people at the highest levels of our government last year, has dissuaded a lot of people from getting vaccinated or caused a lot of fear among people about getting vaccinated. I've been spending this last, from the beginning of the pandemic, I've been working with the Interagency Council and some other groups on providing, webinars and seminars about how COVID is spread and how COVID can be prevented rather. And we still have a very low vaccination rate among the direct support staff in the DD system.
Yep. And I think that speaks to the importance of holding community. Oh, I'm sorry, was someone else going to speak? So I was going to say that I think that speaks to the importance of holding community info sessions such as this. So, so other zip codes may not know the availability of the vaccine. Quote unquote, where can I even get the vaccine? There may be questions regarding that, unsure of the side effects of the vaccine. So that speaks to the hesitancy, the vaccine hesitancy, mistrust of the information in the news. And Michael, I believe you were speaking to this. So on the screen over here, we see a picture of the map of Staten Island. And so the map that is shown on the screen is an outline of Staten Island. The map is outlined in different colors and is outlined by different zip codes. The different colors indicate the percentage of residents in that zip code that have been vaccinated. And unsurprisingly, I have outlined two of them, which are zip code 10303 and 10307. So unsurprisingly, zip codes 10303 and 10307, which are on opposite ends of the island, have the lowest vaccination rate, so less than 30%. And zip code 10303 specifically, which is on the North Shore, houses about 131,000 residents. So it's the most populated, the North Shore specifically is the most populated shore, right, in comparison to the South Shore. And it also houses the largest number of historically marginalized populations, such as Black, Indigenous, people of color, but also people with disabilities. So when we think about the vaccine, it begs the question, why? Why aren't these specific populations, these individuals getting vaccinated? Is it because of lack of resources? Is it because of distrust of the medical community? And regardless of what that why is, it is important that info sessions such as this resources be allocated to the community to ensure that they are receiving the right information about the vaccine. And now on the flip side, we have zip code 10307, which is Tottenville, and only about 5,000 of its 15,000 residents are vaccinated. So that leaves 10,000 Staten Island residents in the zip code 10307 unvaccinated. And again, this begs the question, and this speaks to Michael and to Fred, what you guys were sharing. Why are these individuals not getting vaccinated? And what can we do to ensure that they do get vaccinated? Where is that missing piece? And I hope that everyone that attends today that has those questions, that you are able to ask those questions, that you are able to see the resources that you need or ask the questions that you need in order to get vaccinated. Are there any questions on that before I go ahead and move on?
Isha, if I could just make one comment, I was just thinking how during COVID, how technology has become critically important to all of us, and especially for people with all types of disabilities to interact. And we often say that technology is the great equalizer. And I'm just thinking historically, doing sociology classes and looking at this demographic of if you could pick two communities that probably have the least amount in common, but the great equalizer here could very well just be technology and unfortunately misinformation.
Definitely.
Hey, Nisha, this is Alexa. We had one of the attendees, Nancy, wrote in certain health issues that folks may have may also create a specific vigilance about side effects that might exacerbate some of their hesitancy in terms of getting the vaccine, and especially that there is misinformation out there, but also not feeling like there is enough research or data at this point in time to feel comfortable to move forward with the vaccine.
And I see a lot of that in my chat as well. Jane shared, related to trust, many women of children-bearing years are concerned regarding possible side effects on fertility. Dr. Siasoko, you shared that the J&J, the Johnson & Johnson pause caused more concern. Yep, and I totally understand that. And Dr. Siasoko, if you want to speak to that, feel free to. And I also
Oh, good. Sorry.
No, you can go ahead.
Yeah, I was going to say, the efforts to educate and address all the rumors that have come out through the internet and through other resources, as Dr. Wetzel was saying. There was a lot of folks trying to educate the community and give as much information as we could. And unfortunately, the J&J pause really set us back and caused even more concerns in communities. That was one issue. And then when Pfizer, on a positive note, they lowered down the age in which to get the vaccine to 12-year-olds and above. That also caused concerns among parents. So that's a new group that we have to address and educate and support them to make the right decisions on whether the vaccine was right for them or not.
Definitely. Does anyone else have any questions before we go ahead and move on? All right.
Hi,
Oh, I see Jill. You
Corey.
raised your hand. Oh,
I'm Corey.
I had a question about, do we know like census tract information, particularly for Graniteville, since the area is so big in terms of language and ethnic background, cultural background?
yeah. So to my knowledge, and I don't have it on me, but the North Shore of Staten Island is arguably one of the most diverse locations in New York City. So with that being said, we do house individuals that don't speak English as their first language. We do house individuals from various backgrounds and ethnicities. So that definitely does contribute. And I will also share that in this, and we will share this PowerPoint with you at the end of the session. 30% in almost every borough, less than 30% of Black males are getting vaccinated. So that also speaks to when we think about historically marginalized populations. Why is that the case? And what can we do to ensure that these individuals are being given the right information and that they are also being given the resources to go ahead and get vaccinated? So yeah, and if anyone else can share to that, please go ahead.
I just chatted to Nisha and she can sort of share. This is Jenny from the City Health Department. Our website is very rich in data. We're fortunate that we have a lot of our, epidemiologists and other data folks who are really committed to sharing out as much data as possible to the public. So I'm not so sure that it's by census tract. I myself am not a great data person. I'm more policy, but I do know that frequently they even put raw files so people who want to be able to kind of like look at it and interpret themselves are able to do so. So, oh yeah, it looks like the link is there. So I would definitely encourage folks to, poke around and see what's available.
For sure. And Maggie asked in the chat, and if anyone can answer this, have mobile units gone to communities to administer the vaccines?
Yeah, I can sort of speak to that too from the health department perspective. One thing that we do is really look closely at this data and then try to tailor access to where we're seeing lower uptake. We also try to tailor some of our engagement efforts to where we're seeing lower uptake and doing quite a bit of work in terms of vaccine confidence building. So really using the data to drive our decisions and the bandwidth of our staff and the vaccine efforts to those places where we're seeing, lower vaccination rates.
So I'm going to go ahead and move on. If there are any questions, please do not hesitate to message either me or Alexa or to unmute yourselves. And I see Adrian shared, people can also request the H&H mobile van for specific locations.
Nisha, it wasn't me. That wasn't me. I didn't send it, unless there's another Adrian.
There is another Adrian.
Okay, I was gonna say, I don't want to take credit for somebody else.
No, there is another Adrian, Adrian Abate. If you want to go ahead and speak to that further, Adrian, please go ahead. And I see George asked, do we have any data that reflects the education levels in these zip codes? So I would assume, George, that we can definitely share with you just the 2020 census results, which outlines all of the education and all the zip codes and all of that. So I'm going to go ahead.
I can speak very briefly about what I just shared in the chat. So we have also the Staten Island COVID-19 task force, and we've been looking at this very issue of certain zip codes and geographies where vaccine uptake is pretty low, and then how to promote either vaccination events that are already happening or to set up pop-ups. So one thing that we've been trying to promote is this mobile van. Like if people are having or groups are having community events in those specific zip codes, to coordinate with the city so that we have a mobile van. We've also, Dr. Ginny Mantello has been working with private pharmacists to bring pharmacists in to do pop-ups. So if folks have events or places where they think we could get the vaccines out, please be in touch with, I can put my email in the chat, but we're trying to be creative about partnering so that we're getting the vaccines into those zip codes that really need them. And we can send out the instructions about how to request a van if partners would like that.
Definitely. So thank you.
I want to promote that we're going to actually be doing a pop-up at the Juneteenth event at Snug Harbor this Saturday. Okay, stop.
Awesome. No, you're fine. Thank you so much for sharing that. And I see Dr. Wetzel, you shared most caregivers are female and the effects of vaccine on fertility may deter them from accepting. Yep, and that again speaks to just lack of information and mistrust in these communities. So I'm going to go ahead and move on. So now when we think about who was directly impacted by COVID-19, I would love for you guys to share. And I see Dr. Ginny is joining us, So which populations do you all think were directly impacted by COVID-19? And I can share one. And we all know the elderly were definitely impacted. Anyone else?
I would say Black and Brown communities, people of color, the communities were very hard hit too.
Yep. And I see, Jane, you shared with me the medically frail. Yep.
Individual residential, like residences in congregate settings and group homes where there's a lot of people living in close quarters.
Yep. So we have nursing homes, small businesses, first responders, essential workers, people with disabilities, group homes, children. And when we think about essential workers, that term was definitely redefined during this COVID-19 pandemic. Initially, when we think essential workers, we think first responders, but now we saw a quick change in that definition. Essential workers were no longer just nurses, doctors. Essential workers were now grocery workers. Essential workers were individuals that pumped your gas. Essential workers were DSPs, individuals providing direct services to people with disabilities. So when we think about the vaccine, it's also important to understand, for us to understand, who is getting vaccinated in the disability community and who is getting vaccinated from those that work with people with disabilities. So for individuals living in residential housing, 99.9% of these programs were reporting about 85.7% of the total individuals in certified residential have received at least one vaccine dose. And now on the flip side, for the staff working in these residential homes, in these residential facilities, 31.5% of the total staff in certified residential have received at least one vaccine dose. And now what does that say about when we talk about vaccine hesitancy? Why is this the case? And if anyone on the call, especially our panelists, want to share and speak to that, please feel free to do so.
Hi, Nisha, this is Alexa. We actually did have a question from when folks were registering, and it was specifically for either Michael Weinberg or Fred. If you guys can speak to what strategies have been effective in encouraging staff to get the vaccine.
Well, unfortunately, the strategies have not been terribly effective. This data, which is up on the screen now, I shared with Nisha yesterday, and it's directly from OPWDD as of the 21st of May. And the response of DSPs to receiving the vaccine has been very, very poor, despite some of the agencies doing financial incentives, some of them providing, paid time off to get vaccinated, et cetera, et cetera, et cetera. And it's still much too low in terms of the folks who work in the group homes and the day programs.
Right, so while I would say the numbers are low, and clearly, when you think about the whole concept of herd immunity, we're hoping 70, 80%, that's at least the goal, if not everyone. But when you go back to the other slide of who's impacted, or go back to the zip code issue, when you look at who comprises our workforce, and I think, I don't know if anybody's gonna disagree, but I would say a majority of our staff are people of color, and typically female. Moms in that 20 to 40 range, if I had to come up with a demographic. And so if we think about the people who are less like, I don't like when people say resistant, but the people who are less likely because of concerns or fears, that group that would have the most concerns and fears, or negative history and lack of access. We can talk about equity issues here as well. When you talk about that group, well, that's indicative of a majority of our workforce. So some strategies that have worked is understanding that the number of our staff who also have family at home, or have second jobs, that they leave one job, go to another, or leave one job and go to take care of the children. What has worked for us was bringing in clinics, working with pharmacies to provide clinics on site while people were working. So you didn't have to worry about arranging transportation or finding out where a pop-up center or who's doing the vaccines. We were making the arrangements sort of to make it as simple as possible to get it done. I think the other thing that we did was have sort of people who work here who maybe have a reputation of being well respected and trusted by a majority of people in the workforce, do presentations or town halls similar to this, have panel discussions, take questions from our staff directly. And I think we saw a big uptick after doing one or two of those presentations. So I think there is some things where I'd say there, and I know Fred just mentioned the idea of making a reward system for that. We haven't necessarily tried that. I don't know if we've seen any numbers on what the uptick is. We see states offering $1 million raffles, and the governor's offered free college raffle. I don't know that we've seen major upticks because of that. I'm not sure that reward incentive will work as much as just ongoing education.
Mm-hmm. And I think also I promoted the idea, which you just talked about, of having champions within the agency. Folks who've gotten vaccinated, go talk to your peers. Go show them that you're okay, and you had no effects other than a sore arm or something of that nature. And people I think will put more trust in their peers than they will necessarily. And this is a sad note, since I'm a nurse, in the medical staff.
Yeah. This is Alexa, and that actually, Fred and Michael, you guys led us directly into one of our next questions, which maybe could be answered either by Michael, Dr. Ginny, or Megan. Do you all have any information about any potential funding streams to have DSP champions within organizations, and for organizations that don't have a robust clinical staff? Resources or funding streams to tap into to help with these efforts in different ways.
So hi, Alexa. Good afternoon, everyone. Sorry, I apologize. I was having a little problem joining, and I apologize for joining late. I will just speak to a couple of things. First, in terms of your previous question, in terms of what's working and what's not, having been involved in multiple sectors and trying to work on vaccine hesitancy, we saw this in many, many different sectors as well. So I'll use hospitals and nursing homes as an example. Similar to the numbers that the group homes are seeing, initially when the vaccine was offered in the hospitals, there was a high uptick in, say, the physicians and some of the frontline, but then there were many other hospital workers that were resistant, and it took multiple months of different strategies. So it was not just having large forums or webinars or education. It took small groups, a lot of one-on-one, and then also physicians actually having individual conversations with people that work in their as part of their staff in their offices, having coworkers that have had the vaccine talk to others. In terms of, and I agree with Michael. I think that I don't think of it as hesitancy. I think of more of it as a trust issue, but because I think there's only a small percentage that are truly anti-vax. Many people are just, at the cusp, sort of wait and watch. We're not sure what kind of harm it'll do to our body. We want to wait long term, so on and so forth. So, multiple conversations, multiple points at which you have to show them the data. Also talk to them about the fact that there's 100,000 women that have reported into the vaccine safety, and said that they've had successful pregnancies, they've had successful outcomes with their babies, and sort of coming back to that over and over, and reminding people that these are probably one of the safest and most effective vaccines that we've ever created. Also, of course, showing them how the mRNA actually works, which oftentimes young people will hear things from each other or social media, and then it just kind of perpetuates it and snowballs. So I agree with that you have to keep going back over and over. In terms of funding for creating champions, actually, and maybe Jenny can also comment on that. I'm also working similarly with DOH, MH on improving vaccine hesitancy in nursing homes. I think incentives can come in a lot of different ways. Doesn't just have to be sort of a monetary in terms of cash. You can offer out different incentives to staff in terms of paid vacation. You can offer other perks through HR. So you have to be a little creative. I haven't heard of any dedicated sort of funds for improving vaccine rates, but also one of the other strategies is, for example, we've been talking to some of our local partners. I'll use the Staten Island PPS as an example to see if there's ways, if they're working with that sector, to see if there's ways to incentivize staff to get vaccinated. So I think we have to think out of the box and be creative. And maybe there's way to tap into either local resources or local government to see if there's way to incentivize, or even local organizations have to think about how they can sort of channelize their funding streams different ways. So I'll stop at that.
This prompted a thought that I had. We do offer sort of a train the trainer building vaccine champions sort of slide deck and presentation. And it's obviously not something that we, the health department, could really compensate staff. But if there were another mechanism by which a provider organization wanted to compensate their staff member for participating in something like that, we could certainly set up and schedule the sort of the training and the webinar. And, we're also fortunate that in some cases, with some high numbers of vaccines, that we're now able to do some of these trainings in person. So it makes it a little bit easier to kind of talk face to face about your concerns, what your experience was, why you might have sort of changed your mind if you're an individual who's initially hesitant and then decided to be vaccinated and really wants to share that message. So I think, we are certainly here as a resource, and that is a resource that we have, and we'd be happy to partner with anybody who is interested in delivering that training or identifying, a couple of their staff to participate. Maybe it would be a good challenge. Ginny, we're doing this with the nursing homes together, sort of the same thing, where it's asking each of the group homes across Staten Island if they could identify one staff person to kind of attend this training. So certainly something we could do.
Yeah, this is Alexa. I think that's a perfect segue when we get into our breakout rooms and we try to develop some of those strategies that maybe, providers, and not even just in Staten Island, but across the different boroughs, can come together and, one provider host the training and everybody send folks, and that's great. Awesome. And those are all the questions I have for now, Nisha, unless you have more in your chat.
No, I'm good. So I'm going to go ahead and move on. So really quickly, I actually want to go back. I want us to remember that 31.5% total staff. And I also want us to remember that whole essential worker mentality that we have now, that DSPs are in fact essential workers. So why are only 31.5% of them getting vaccinated. So now when we think about COVID-19 risk for specifically people with disabilities, disability alone may not be related to higher risk for getting COVID-19 or having severe illness. And some people with disabilities still may be at a higher risk. And that could be due to close contact with direct support providers. So DSPs having trouble understanding the information or practicing preventative measures. So when we go ahead and break out into our breakout rooms, for anyone that is in the room with Dr. Jenny, what is it when we think about vaccine hesitancy? How can we ensure that the population that we're addressing, the information that is being disseminated is also accessible? Because having trouble understanding information or practicing preventative measures is also a key in understanding why some people aren't getting vaccinated. And also where they live, long-term care, home, community-based group homes as well. So now the impacts of COVID-19 on agencies, again, this idea of staffing and DSPs are essential workers. So now professionalizing the role of DSPs, we are out here telling people that you're an essential worker. So when we think about essential worker, we think about that nurse, we think about the doctor, we think about the pharmacist. So now professionalizing the role of DSPs and recognizing the worth and the need for DSPs, especially in this setting, is so important. And one of the impacts of COVID-19 is the recognition of just this, that we need to professionalize the role because now there is such a need for these individuals. And also something that I wanted to point out is that we saw it firsthand back in March, when the majority of the population is impacted, the minority of the population is forgotten about. So IDD provider budget cuts, we saw that immediately after as soon as the pandemic hit, there were immediate budget cuts to the IDD providers. And why is that? Because again, when the majority is affected, the minority is forgotten about. And the COVID-19 pandemic is proof of just that.
You know, Nisha, this is Chris. I just wanted to say when the pandemic hit in March of 2020, you know, most of us on this call here, we had to advocate fiercely to make sure that the role of the direct support professional was classified as essential employee. We had to advocate for that in order to get that designation. And then when we got the vaccine, we had to advocate again to make sure that direct support professionals were amongst the first groups, you know, to be vaccinated, not only them, but also the people that they support. So it's a constant fight. We expect people to perform, you know, this significant role, this noble profession, to be there, you know, to make sure that other people are safe and feel comfortable and they're secure in their own homes while they're leaving their own families at home. But imagine we have to do all this work just to make sure that they themselves, the direct support professionals, they themselves too are safe and have all of this information.
Right, Chris, that's a great point. And I think as much as we can look back at what happened, I think, you know, and maybe we'll talk about this in a breakout group or later, but I think this is where everybody on the call, we need to work together with the new administration on a federal level, putting together the American Jobs Plan, that if there's, I believe there's 400 billion, that's with a B, $400 billion for care infrastructure. And part of that care infrastructure, you know, we have to make sure that it goes to people who care, that it goes to people who are supporting people so that they can have lives that they want to live. So we have to take care of the people who care for others and really push that, because my concern would be with this theme is that money's come to New York State, but somehow they don't make it down to, you know, people working with others with disabilities, especially, you know, we're working with people with intellectual and developmental disabilities. But just because it comes to New York, you know, if we go through our history, doesn't mean it's going to make its way to where it should. So that's part of our future advocacy fight for, you know, for people with disabilities, but also for the staff who work with them. You know, we talk about professionalizing the role, and you know, if you don't put the money where it needs to be, then you're devaluing the workforce. And if you devalue the workforce, you're it's the devaluation of people with developmental disabilities. So I hope all of us will push as this money starts to roll out from the federal government.
Yeah, and I know that, I think the assembly member had to leave, but, you know, since we have that weekly phone call with him, we'll be talking about, you know, getting those monies to come on down. That's one of the things that, you know, we will make sure is a priority.
Absolutely.
Perfect. Thank you, guys. So for anyone on the call that joined specifically to understand why it's important to take the COVID-19 vaccine, so we provided a couple of slides on that over here. So now the COVID-19 vaccine is here, and anyone ages 12 and up are now eligible to get it. So if you have any questions, comments, or concerns regarding the vaccine, that's great. Let's ask them here today, and let's make sure that you leave this call with all your questions answered. So just some things to remember, that the COVID-19 vaccines are safe. Dr. Ginny has reiterated time and time again. They are safe and effective tools in the fight against COVID-19. COVID-19 is very serious and can cause severe and potentially long-lasting medical complications. And some people have died after contracting COVID-19, but no one has died from getting the vaccine. And I see Ryan, if you can, Ryan has asked me something in the chat. Ryan, if you don't mind unmuting yourself or kind of restating it.
I'm Ryan right here, blue shirt. I think it's advice for vaccines because, like, I know it's very mandatory to get it, and that I think it's the only way you can get it right away. You can always be safe.
Hi, this is Alexa. Ryan, are you asking about whether right now the vaccine is mandatory?
Actually, that's what I was trying to ask, different than that.
So right now it's not mandatory. It may be mandatory for some places that you go, or in the future employers may make it mandatory, but right now it isn't. And it seemed like your second question, and correct me if I'm wrong, was access to where to get the vaccine. Is that right?
Mm-hmm.
Okay, perfect. So we can definitely share some resources on that. I believe Adrian Abate was sharing before. They're actually going to have a pop-up site this Saturday at Snug Harbor. They're having an event. And I know me and Nisha have your contact info. We can definitely send that over. And I believe we're going to be working to host some more vaccination clinics at our location as well. So if you feel more comfortable coming to our building on Granite Avenue, we can try to help you with that also.
All right.
I also, if I can add to that, Alexis, that through the past weeks and months, we've been able to partner with many agencies. Anyone that is wanting to host a pop-up site, we've been able to link them with either pharmacists or qualified health centers or providers in our community to be able to bring the vaccines to their sites. And as I think Michael was saying earlier, many of the pharmacies have been bringing the vaccines to the group homes, and we know that Fred and Michael and some of our pharmacist partners, Anexia, for example, have and Beacon have been really, and of course I should also mention Dr. Siasoko. They've been really working hard to be able to make access as easy as possible for not just the developmentally disabled community, but anyone in the community that is having transportation issues or childcare issues. We have now many pantries and some community centers that are hosting it on a regular basis through the summer. And we're certainly talking already to PCCS to have a regular presence of vaccines. And having Pfizer, which will also be available for younger individuals. So more to come, but certainly can help direct anybody that is having access issues to many different locations. And we also have access to ask for city DOH, MH, and H&H vans. So that's also something we're going to be working on over the next few months.
Hi, this is
Well,
Alexa. Thank you, Ginny. I wanted to just share, I'll be sharing, Nisha shared in the chat vaccinefinder.nyc.gov. And I'm going to also be sharing in the chat what Adrian sent in for the location of the vans this week. So those resources will be there. And we'll also make sure to include them in the resources when we send everything out to everyone that's registered. We did have 2 questions, and Nisha, you can pause me if there's a better spot for these questions. They're medical questions related to the vaccine. So I'm not sure, Dr. Siasoko or Dr. Ginny, if you guys want to tackle these. One question is, does the vaccine interfere with other scheduled immunizations? And Dr. Siasoko, if you want to go ahead. Sorry.
Sorry.
Yeah.
Go ahead.
Sorry. I just want to add one more thing on to what Jenny was saying in regards to access to the vaccines. There are also pharmacies, thanks to Jenny to bring attention to that, pharmacy that are willing to actually go into the homes of individuals and give the vaccines on site. So those individuals that are scared of needles don't want to come out of their homes. There are pharmacies that Jenny can let you know that are willing to go there and work with the families to administer the vaccine. So I think that's key. You know, unfortunately, it's rare, but it does happen where individuals and caregivers don't necessarily want to come out. So there's possibilities and other ways to improve the access. So, but in regards to the giving the vaccines with other scheduled vaccines, as of now, there is no contraindication to give, for example, the Pfizer vaccine with other routine immunizations. Having said that, there are timeframes in which you should not be getting the COVID vaccine, for example, if you've had plasma therapy or if you are sick, obviously. So if you've had treatment, then you have to wait 90 days. Obviously, if you were sick, you have to be in quarantine and isolation a certain amount of time before you can get the vaccine. But in regards to giving the vaccine with other scheduled vaccines like the flu vaccine, there is no contraindication or time frame issue.
Great, and this is Alexa. Can you just describe a little bit further what contraindication means?
So when you say contraindications, or Jenny, did you want to speak to that?
Oh, Dr. Ginny, I think you're still on mute, sorry.
Sorry. No. I was, no, I agree with that. The guidance has changed. Initially, we were told, everybody was told that do not take the COVID vaccines if you've recently been vaccinated, wait for 2 weeks. A few weeks ago, CDC changed that guidance for both adults and children, where you can, particularly this is important in children because many children have fallen behind on their vaccination schedules. And through the summer now, as we try to catch people up on their vaccinations, and come August, as we start to get them ready to go back to school, it's important that as they're catching up with their other vaccines, that we're able to co-administer. That means we can give them, together with the COVID vaccines. And we haven't seen any serious side effects with the COVID vaccines. And that would have been one reason to wait. So if you're giving 2 vaccines that might potentially be having side effects, you don't want to give them together because you don't know if that side effect was from the COVID vaccine or the other vaccine they received. But now they deem them safe enough that you can give it with other vaccines. To what Dr. Siasoko was referencing is that there is nothing that will prevent you, so to speak, unless the only reason for not being able to take the COVID-19 vaccine is if you've had a severe allergic reaction to one of the components of the vaccine. And when you say contraindication, you mean, what it means is that you cannot take the vaccine at all for one reason or the other. So there are some absolute contraindications. An absolute contraindication meaning if you've had a severe reaction to one of the ingredients in the vaccine before, they recommend you don't take this particular type, which is the mRNA. You can take another vaccine, that doesn't have the same makeup. And then there's some relative contraindications. If you've had a severe allergic reaction to some other intravenous type of vaccine, then they suggest that you look at options, discuss with your doctor.
Wonderful. Thank you so much. And the second question here that I think will likely be for you both again, and hopefully I get the name of this medication pronounced right. The question is the medication ivermectin a possibility to treat early signs of COVID-19?
Ivermectin.
Thank you. And whoever wants to take that and speak on it a bit, if anybody has any information around that. Okay, no problem. We will try to get some information for the folks that had asked that upon registration.
Yeah.
And we can send that out. Sorry, Dr. Sierra-Soko, go ahead.
Yeah, sorry, I was on mute. Jenny wants to say something to that?
No, I was all I was going to say is, to my knowledge, that ivermectin really has not been approved to either treat or prevent COVID. So I don't know if you have anything else to add to that, Vincent. But
Yeah.
Yeah,
that's what I was going to say too. I'm not aware of any indication or recommendations for that medication at this time.
Okay, great. Thank you, guys.
You can also email myself, and I can route that through to one of the clinical directors at UHMH to also ask.
Okay, wonderful. That'll be perfect. Thank you.
Yeah.
And those are all the questions I have, Nisha. I'll pass it back to you.
Cool. Thank you. This is Nisha. And just as we were going over who COVID-19 is likely to affect and things like that, people in certain groups or with certain characteristics are at greater risk of becoming seriously ill with COVID-19. People with psychiatric disorders, particularly serious mental illness, have higher rates of COVID-19 infection, serious illness, and death. People who use tobacco are more likely to become seriously ill and hospitalized with COVID-19. People who use drugs may be at a higher risk due to lung and vascular health, as well as less access to care. And finally, COVID-19 patients with substance use disorders had worse outcomes than those without substance use disorder. African-American patients with substance use disorder, particularly opioid use disorder, had the worst outcomes. So now when we think about getting the COVID-19 vaccine, the COVID-19 vaccine protects you. It helps your immune system build up its natural defenses against the coronavirus. If you get exposed to COVID-19 after you are fully vaccinated, your immune system is ready to protect you. The COVID-19 vaccine protects others because when enough people get vaccinated, COVID-19 will not be able to spread. This means that overall rates of infection will go down and the pandemic will end. By getting vaccinated, you are protecting your community. And more than anything, the COVID-19 vaccine protects everyone. When enough people get vaccinated, COVID-19 will stop mutating as quickly, which means that we will see fewer new strains. And in order to get to a post-pandemic world, taking the vaccine is the best long-term way to get to a post-pandemic world. If enough people do not get vaccinated, we will continue to have surges, restrictions, and lockdowns periodically for years and years. We are in control of how long it takes to get there. Our actions make a difference. So we are going to go ahead and go into breakout rooms. Alexa, I believe Michael Cusick left.
Yes, so we're going to have, hi, this is Alexa. We're going to have a little bit of a change. We're going to bring Dr. Ginny into the room with myself and Chris, since there's 3 folks in room 1. And each room is going to have a bit of a different focus, all related to COVID and how we continue to move forward, but a little bit of a different focus in terms of what can actually come next. And so each breakout room will have what we're calling a Zoom room host. So I'll be one of them. Nisha will be another. You'll see Alyssa D'Augusto and Lucia Rossi. And we'll be taking notes, and we can share screen in the breakout room on what's called Jamboard. And Nisha, I don't know if you want to pull up Jamboard just to have as an example so folks can see. So we have a couple of question prompts for each breakout room so we can help put together a toolkit of strategies moving forward to target 4 different areas. So The first breakout room will be looking towards how can we continue to address vaccine hesitancy and make sure that IDD providers and people with disabilities have access to vaccines. So one of the examples that we heard of that would be able to be typed into here was working with Jenny from DOH to do some sort of maybe DSP champion training and train the trainer for folks that have gotten vaccinated and want to help share and spread that message. That's a strategy that we can put together as an example for there. And then we can go to the next one. Room 2 will be with Dr. Fred Wetzel and Michael Weinberg, and we'll be looking at what can providers do in navigating the impact of COVID-19 on people with disabilities and the provider agencies as a whole. So one of the examples for there would be a lot of folks are struggling with coming out of isolation or are having a hard time getting back to their routines. What are some things that we can do to help folks with that? How can we better prepare for the next wave or the next pandemic? And I think that question got cut off there, Nisha, but I think what it means to say is what can be in place to help IDD providers engage their staff to be vaccinated. And I'll fix that as we go into the breakout rooms. Room 3 is going to be looking at, with Jill Cornell from the Office of Emergency Management and Dr. Siasoko, what can we help do to prepare providers for either the next wave or a future pandemic? And how can we help support people with IDD and their families, as well as providers, for emergency preparedness on a whole scale? So one of the things that Jill brought up in one of our initial conversations that got me thinking was how many people truly realize who their emergency contact is. Just having discussions about who your emergency contact is. And I had to think about it, and I was like, actually in my phone, I don't have that set up either. And so having some of those conversations. So ideas around that could be maybe doing a training series for residential managers on pandemic preparedness. So that'll be room 3. And then room 4, which Dr. Ginny will be in with us. And Chris also meets with Michael Cusick on Wednesdays, as she stated before. So she will definitely be bringing this information back into him and the other legislators. But where do legislators stand in terms of getting funding or support to professionalize the role of a DSP? One of the questions I know that several of our attendees were interested in hearing from Michael, which I will ask Chris to ask him, is does he understand what we mean when we ask about professionalizing the role of a DSP? Does he know what that entails? And what will legislators do to advocate for increased funding for IDD providers? So those are going to be our focuses for the breakout rooms. We will take about a 6-minute break, and I'll launch the breakout rooms at 2:10, so everybody can have a few moments. If you want to stretch, get a glass of water, a cup of coffee, whatever suits you. And I will start to open up the breakout rooms. It does take us a few minutes, but you will get an alert on your screen and it'll say join the breakout room. And then you'll be in your breakouts, and we're going to be in there for about a half hour. You will see a notification at the top of the screen when folks are going to come back out of the breakout rooms. And then we will share out and we'll reshare the Jamboard and see what everyone comes up with. And we're hoping this can be a time where everyone's really sharing with each other all the different experiences that everybody's bringing to the table. So hopefully everyone can take a nice few-minute break, and then we'll come back and go into those breakout rooms. Hey everyone, this is Alexa. We're going to be coming back in 1 minute. So whenever you are back with us, if you want to drop in the chat or feel free to come back on camera and we will open up these breakout rooms. Awesome. I see some folks back with us. Great. Awesome. All right, perfect. It looks like most folks are back. I'm going to go ahead and open up our breakout rooms. Chris and Dr. Jenny, I'll be in our breakout room a few minutes after. Just want to make sure everyone gets into theirs so I can send that message so that way everyone knows they can start. So as
Hi, everyone. I'm just going to wait for others to join. While we wait, my name is Alyssa DeGusto. I'm the communications manager at PCCS, so I will be moderating this group. So it looks like we have a nice group of people here, and I know Fred and Michael, you will be working with us as well. Thank you again for your participation in all of this.
You're very welcome.
Thank you.
So I'm going to share what our activity is on the screen just so you guys can start to take a look at the questions that we're going to be posing and kind of talking about. So basically what we're going to do is talk through the questions. I'll be taking notes and posting them onto this Jamboard. And then when we all come back, we'll be sharing what we came up with.
Michael, it's Fred. Would you like to start?
Sure. Sorry about that. I was waiting. So what could providers do in navigating the impact of the COVID pandemic? So I think it's a twofold, or maybe even threefold, right? It's the past, what we've been through for the last year, the situation we're currently dealing with and working on, and then how do we move forward? So I think as far as looking at the impact of COVID, and part of it goes with making sure we're prepared. I mean, first and foremost, what did we learn? And it's that we have to be prepared for something like this. And again, I think it caught us as a field. I think on a national, state, city level, we could all point fingers. Things weren't necessarily handled as well as they could be. But I think we have to be prepared, which means making sure you have PPE and get a jump on as much information as possible. So that's one. I think there is a push for our field, given that they're essential workers and recognized as such. And so I think part of what we could do in navigating the impact there with staffing is looking at the profession itself and really advocating again, for the living wage, if not more, given what we went through, and really the everyday heroics of our staff who throughout the crisis became not just a DSP who was providing supports and services, but a caretaker, working under the license of a nurse, being almost a medical triage person. So I think that's also part of what we could do. The other thing, and I think, sorry, Fred, just jump in whenever, I'll be quiet.
I agree with both of those, Michael, and I think, also that what's important is that agencies and providers have an emergency, and all what the feds call an all-risk emergency plan, and it's required for the ICF providers. I assume you've seen them, since AHRC still has some ICFs, correct?
Yeah, as a matter of fact, our requirement for an all risk plan then gets broken down into very site zip code related issues.
Right.
Pandemic, surprisingly, the two of what's provided by the state, the two and the federal, the two that did not make the cut based on our zip codes were pandemic and civil unrest. And 2020 was, represented by both. And I think that's something else to keep in mind, if you will, a lesson learned that was talked about a little bit, I think, based on the data from the slides. I think moving forward to look at the impact, we kind of have to make sure that we're not in our own sheltered world of just advocating for people with IDD, intellectual and developmental disabilities. Not only do we have to work with other organizations that work with people with disabilities, but I think we need to look at other disenfranchised groups. If you look at what nursing homes went through, the elderly are a disenfranchised group. If you look what happened in, lower income areas and the disparity of access to healthcare or medical treatment, or just look at unfortunately the death rates of people of color in different neighborhoods. I think we have to look at working together and not be so, if you will, vulcanized into like we're about disability rights as opposed to seeing the bigger picture. And I think 2020, if not for society, hopefully for our field, makes us really look at intersectionality. I know PCCS does a lot on looking at that. I know we do, but not everybody does. And I think it's time that maybe COVID did bring to light for us to really look at how we are interconnected with other people when we talk about the issues of equity, which were clear not just for the people we support, but also our staff, and how that is all linked together. So it's not.
I agree, and I think that the disability community in general has to come together and organize, because in numbers there is strength. Is the old, and also in terms of the professionalism of the DSP. Have you looked at there's a movement that IAC I know has been talking about a little bit, and especially the NADSP has been talking about developing a federal occupational classification for DSPs, because currently there isn't one, so they get sort of lumped in with nurses' aides and things of that nature, and are not recognized as a specific profession.
Right, so we're looking at that, I know, besides IAC, but also with, NISARC, on sort of a national, the NADSP curriculum, sort of a coursework that better defines the trainings across the board for DSPs as well. So I think looking at that again, because, it's a lot that we could say it. We talk a lot about thought leadership. But I think, now's the time, if you will, a call to action, but, it's that action leadership that's needed now. So I think, whether it's making it a well-defined professional function as DSP, and even the frontline supervisors here, I think that's something we need to do to navigate the impact. And then, Fred, I'll leave, any thoughts on health, but I could look at from the financial issues for agencies and for families out there that, we call them the unkindest cuts that happened on May 1st. And I know it's still debatable, the assembly, we know Mike McCusick was on the call. They're looking to see if they could delay or fight this. But, on May 1st, every agency, and this impacts the residences, two major impacts. One was for anybody who's on leave, that means going for a home visit, a vacation, or being in the hospital, funding was cut by 50% to the agency for every day the person's out. So when you're talking about right on the heels of a health crisis, that was scary to lose 50% of funding for those particular leave days. And the
Yeah, and
other-
I think what may not be understood by the politicians, it's surprising that wouldn't be understood, is that when someone is in the hospital, that doesn't mean that we can tell a DSP to go on leave. And not,
Absolutely. Right. You don't furlough. It's the same thinking of telling your landlord, yeah, I went on vacation for 2 weeks, so I only owe you half a month's rent.
Right.
You know, to oversimplify that, it's sort of insane. So I know Michael Cusick got it when I said that. So try to make it plain for people. And the other one that I think became an issue was losing the rate adjustment, the occupancy adjustment. And so what used to happen is if somebody left, moved out, sadly, if somebody passed or went to a nursing home on a permanent basis, we were still funded for the bed. Same idea, like just because the bed's vacant or, you know, during COVID, 2 out of 8 beds now became vacant because of loss. Plus 25% of the people. Well, we don't furlough the staff or cut people's benefits. They were still needed to work with 6 out of the 8 people that the house normally would have. And so we lost the occupancy rate adjustment, and that went to 0. And so right on the heels of COVID, as every agency experienced loss, and especially every agency that has a medium-sized to large-sized residential program, definitely experienced loss. Then all of a sudden you're losing your funding as you're trying to fill vacancies. And again, we did place a number of people who were in emergency need, people with disabilities who experienced their own COVID emergencies who now needed housing. So we were glad to help people. But while you're doing it in a pandemic, it's not the easiest thing. And to have that cut take place, you know, we call that the unkindest cuts. It really was not looking at the, I think it was toned.
I agree wholeheartedly with that. And you know, we are funded for staffing at the lowest level. It's not like there are extra staff around.
Right. You know, so I think how else can we look at the impact of or navigating at? I think, you know, moving forward, not only looking at telehealth but teleservices, that, you know, this is sort of a mixed bag. It's great for people who enjoy that,
right?
But it also could, you know, lend itself to like a small home of 4 people. You know, if nobody goes out during the day, Monday through Friday, and they're all on their iPads, you know, a 4-bed IRA could easily become an institution because there's no interaction with the outside community. So we have to look at the pros and cons of teleservices. And if this is something that's staying, which apparently OPWDD just said as of July 1st, it's a permanent part of services, then it needs to be funded. You know, the bandwidth and the iPads and the tablets cost money.
And OPWDD and you know, and the politicians, of course, also need to be reminded that going to work for some of our folks is their socialization.
Absolutely.
Those are their friends that they're going to work with. And if we're going to isolate them in their house and do everything electronically, we're greatly, you know, increasing their isolation from the community.
And I think, Fred, I don't know if this has been discussed from the medical perspective, but just, you know, when we're looking at the impact of day habilitation services or day centers, as much as they can go back to 100% capacity with the 6 feet of distance, you know, that logically can't happen because you need the space, and space in New York City is at a premium. But even looking towards agencies that have very large programs, whether they're ICFs or IRAs, you know, that open post right after the deinstitutionalization, you know, the idea of like having a 20, 40 bed house somewhere in the States needs to be looked at and possibly funded to create maybe 4 smaller IRAs or 8 smaller IRAs, just because I think, you know, we talk about the issue of viral load. How many staff work in a house? How many people live in the house? How many shifts partake in the house? How many of those staff are traveling on mass transit and increasing exposure? So I think we do have to look at size.
Yeah, absolutely. The major reason I think the nursing homes were hit so hard was because they are large facilities, you know, for the most part, And staff are, as you say, staff are going in and out every single day. And then a lot of staffs do travel on public transportation, especially down here.
Yes.
So it's really an infection control issue as well as a, you know, an
Right.
issue of the mental effects of isolation on people.
Right, and I think, you know, you're talking about that isolation is just whether it's really conceptually or the reality. We just have to make sure people aren't being left behind as we're moving into, like, you know, new ways of doing things. I think it's really important to make sure that everybody has the same access. Again, I think it comes back to an equity issue for people and families, and I often think I spoke to Chris Marchione, you know, about how a lot of us were living off of Amazon, and not just personally, but as agencies, you know, placing, and somewhere in there, it took probably 6 months, putting on my teacher's hat, looking at the equity issue and going, does everybody have access to Amazon or, you know, to order cleaning supplies? You know, that's again gets back to something. How do we navigate and make things fair for everyone?
So do we need to look at the other side of the board? I see the cursor moving over.
Yes, that's very good. Nice cue.
I think that the idea of, I still like the idea of promoting champions and training staff to be champions for other staff in terms of, you know, saying, look, I got the vaccination, I'm fine, here's why you should get the vaccination. And again, to remind them that the people they're supporting are also in danger if the staff don't get vaccinated.
Yeah, I think it's been a fine line, Fred, just between giving people information to make an educated decision without seem to be pushing fear and guilt, right? It's like, look at how many people passed, you know, especially where, you know, any one of us where you work, if you knew people who passed, it's a reality, and we're trying to prevent that, but you're also not trying to play, you know, or manipulate people emotionally.
No, of course.
Yeah, so it's a fine line. You know, we don't want to do fear mongering, which I think is part of the hesitancy. We also see that, you know, people really were scared from the reality, but also the everyday on the news. So you want to kind of play up the positives that it is effective. So if you will, it's not only education, but education playing up the positive, I think.
Right, absolutely. And you know, it's been proven in public health education for years that people don't respond to fear. You know, otherwise the level of smokers in the United States wouldn't be going up.
Right. That's a good point.
But I did, you know, one of my certifications is in counseling, and I did go on a counselor board and say, you know, reach back into your training and let's talk about PTSD, because there's going to be a lot of that.
Absolutely.
I mean, those DSPs who stayed in houses with people for 2 weeks, 24 hours a day. I mean, that's, you know, that's got to be tough on you.
Absolutely. No, we when we were going through it, thankfully, you know, us, we have a very large clinical staff in a clinic. And one of the things that we mobilized was a lot of our therapists and counselors to start calling into the houses, not just because of loss, but because of the loss of routine for everyone. So we were dealing with like sort of two mental health issues. The one is like the grieving, and the other one is like the loss of routine for everybody. You know, the men and women we support as well as our staff, and working through that to the point where, you know, a vast number of people were basically, you know, functionally depressed.
I know a few folks who during this, and these were professionals, actually had breakdowns.
Yes. So I think, you know, the champions really accentuated the positive, having forums on a regular basis where people can talk about it, and again, where they could feel free to say why they're afraid to get it, and, like, you know, and acknowledging that. I don't think it does any good to, you know.
Yeah, just hit the nail on the
that we know the answer, to everything.
I mean, when I was doing webinars, for IAC, I mean, I would talk about Tuskegee, right out, not hiding it. Here's why a lot of people of color are afraid. This is what the government did. I think also, and we did this, of course, was to try and have, if there were speakers, to try and have a racial balance among the speakers.
Absolutely.
Yeah.
You have to understand the room.
Mm-hmm. Exactly.
And I think, what else could be done is I think I wish our numbers were higher. We're sort of in the middle upper 30s now. It's not like we're at 50% even yet, but
Yeah.
I think, trying to work with whether it's pharmacies, the Department of Health, or different city agencies to bring the vaccines to you. So like right here at work, you don't have to take time off. I think making sure that we're making it as easy as possible for people to get it, so that they don't have to go online and find out, oh, is there a line? I do think we saw our numbers go up after the first month of doing this, and I think also being consistent. I know it's an ICF regulation. You have to keep educating and keep talking about it with your staff, but I think it's something we would want to do in any site, whether it's residential or not, to really continue to educate people, and the more people who are getting the vaccine, so that it's being shown to be safe, not just saying
Right.
it, seeing the numbers. I think that also helps people, and sometimes when we show up, there's people, you're supposed to register an RSVP for the vaccines. And so just because we're there, people go, can I get vaccinated? Like, they'll just change their mind right there because it's there.
Yeah. Yeah, the pharmacies have really been terrific, I think, with a lot of the agencies. I know I was vaccinated by one of the agencies where I'm a consultant. And it was interesting because they asked me if I wanted to be, and I said, well, I'm not an employee. And they said, you are today. Go get vaccinated.
Right.
Does anyone else in the room want to speak? Michael and I can go on forever.
Either one of us can go on forever. So together, it's going to be tough.
That's true.
I was kind of thinking while you were talking, and probably a lot of what I would say is built into some of what you said. When you talk about strength in numbers, I think, that providers presenting a unified front to the community, so that when there are things like community events and things of that nature, maybe have groups of providers manning tables for vaccines and for vaccine information. And especially now with the warm weather, this is a prime opportunity to be out. There's more and more community events happening in the parks and things like that. So I think there's that piece. The other thing that I was thinking of, and I think it's built into some of what Fred was saying, is the mental health awareness, PTSD, grieving loss, all of that, that you can't really ignore that in your staff, because this pandemic, needless to say, didn't just affect the people we serve, it affected each of us. Many of us may have suffered from it, lost a family member to it, have fears about it, some of the people that you work alongside of day by day. So I think, that mental health awareness is key, and that anything you can do to support that in staff is good. I don't know how much it would help, but maybe in some instances, maybe an extra day off with pay. I don't know, could be an option, or something that would be, or something meaningful to staff. I'm not really sure that would play out in so many areas. I think there was some incentives being given at one community event, like a $10 gift card or something. And I don't know, how that ended up.
One agency I know that I've worked with, and not all agencies would be able to do this, but they would give a staff person a $25 gift card every time they got tested, a $25 gift card to get the first vaccination, and a $25 gift card to get the second vaccination.
And then I'm not sure if it was Fred or Michael that said it, but you know, if we're trying to reach, especially those communities that were described earlier on in today's event, you know, where there's only a 30% compliance rate, where many of the caregivers are people of color who have this distrust from things like Tuskegee, you know, I think that to the extent that we can have those people be voiced, those people who've been vaccinated from those communities be voices. I think we're even seeing that from DOHMH on the news broadcast now. They're showing doctors who are people of color, you know, promoting the vaccine. And also, you know, I'm sure some of you heard that one of the people who was a developer of Moderna was a young African-American female doctor. And that she's, I think her name is Dr. Corbett. I think that's her name. And that I read that she's now trying to educate communities. So, you know, information like that is important to disseminate, you know, that, hey, this was not developed by some people in the background, you know, that are trying to pull the wool over your eyes, that some of the participants in the development of these vaccines were people from communities like yours, you know. So I don't know if we can promote the positive, that it's not, you know, something that just the government is doing. Yeah, so it's just really, I just like personally, I just find it so hard to believe that any government would let so many millions of people be at risk for something that was questionable.
Of course not.
Hundreds of millions of people, you know. So I don't know. They're just kind of, you really pretty much said it all, but I thought that maybe some of what I was thinking could have been an enhancer.
Yeah, this is Maggie. I agree with Jane and with both, you know, with Michael and with you, Fred, what you were saying. I think the incentives have to be meaningful. I think they have to apply to, you know, people's, you know, lives as lived. And if you could maybe promote incentives that, you know, that mean something to the DSPs, and, you know, you know, ask them what would be meaningful to them, something that may be applicable to their life experiences, something, you know, if paying for groceries or paying for transportation, something that makes their life a little bit easier, you know, may go a long way. We at the hospital have done, you know, incentives for our employees as it got harder to convince them that it was really in their best interest to get vaccinated. So I just think that it's just a better way to inform compliance when you make something a little bit more meaningful. And when we were talking about the first part, the providers, how we can navigate the impact of the pandemic, I was thinking about like lessons learned, and how I heard from a lot of parents and caregivers about their you know, they're individuals in the group homes who learned that going to program was no longer something that their individual was either enjoying or needed in their lives anymore, and how, you know, their daily activities and interests had changed as a result of the pandemic. So I think there were like lessons learned as it had provided everybody a chance to kind of reflect on what were some of the some things that came out of this whole experience, like online learning and you know, people who whose jobs converted to their homes. Like there were so many lessons learned, some good, some bad, but you know, I think for IDD population, I think we have to go back and kind of look at what were some of the pros and cons, and maybe for individuals with disabilities, you know, we have to start kind of digging a little deeper and peeling back that onion and say, what are some positives that came out of it, or some negatives, yes, but what are some positives that grew out of it? Was telehealth the best way to provide an exam for them? Maybe yes, but you know what? Maybe it wasn't the best approach for every individual. So I think there are so many so many perspectives on how we could approach some of the impact that this pandemic has had on DSPs and on our individuals.
Right, when after the apex, so last summer, towards the end of last summer, so you're right, August, September, when we were when day programs were first opening back up, and we were talking to people if they wanted to go back, you know, if the opportunity arose, you know, one of the most common things that we got with yes, but was people enjoy sleeping till 7 o'clock, 8 o'clock in the morning, and not getting up at 5, 6 o'clock to get breakfast to go catch a van that was going to pick them up. So, you know,
Yeah, my favorite has always been, they have to go out 3 times a week for recreation. My answer is usually, do you go out 3 times a week for recreation?
right, you go out once a week for recreation. So the whole idea of getting out, and I think there's the idea of choice, but how do we make sure that's informed choice and not the choice of somebody who, again, is functionally depressed? You know, these are all things I think we need to look moving forward. Again, just getting back to helping staff as far as the hesitancy, we talked about ensuring, you know, education about COVID, but I also think maybe getting health literacy out there. You know, Fred, you could probably talk to this, just health literacy, like a lot of us talk about comorbidities.
How
Right,
about some focus groups for staff to find out what is their hesitancy exactly? Hear it right from the staff, because we're giving them education, but let's see, how about some focus groups amongst the staff who are not getting vaccinated to see what they need?
We've got 15 seconds, according to what I see on my screen.
Thank you guys so much for all of your great answers and input. This was really dynamic. That time went super quickly, so thank you.
Hi, everybody. Welcome back. This is Alexa. I think most folks are back with us. Yep. So Nisha, you could go ahead and get started. We can do the recap of the breakout rooms. It looks like we got a lot of great stuff in there. Oh, I think, yep.
I'm gonna go ahead and share my screen. And if everyone from each room wants to share, are we comfortable with that? All right, cool. So I guess I can speak for my group. We focused on vaccine hesitancy. I had Jenny and Megan in my room as our panelists. And something that we were speaking about was continuing to present the facts. Something that we recognize is that you can't dehumanize the process of the human, right? So something that Frank, you spoke about was becoming a champion in your respective community. So what does that mean? That there may be certain communities that may not reach what we're talking about, what we believe. So find individuals to be champions of the vaccine so that they can share with other groups and populations that may not be receiving the message. And I provided an example of how I work with youth at Port Richmond High School. And one of my students, she went ahead and got the vaccine. And she was the first of, I want to say, anyone in that large group of friends. And then it became like a chain. It was like, oh, Ariba got the vaccine and she became the champion. And even though here I am preaching the vaccine all the time, it wasn't like, oh, Miss Nisha. It was like, oh no, Ariba. And it's all about becoming the champion of the vaccine. And we were also talking about, and Frank, you could definitely say this better than me, but this whole idea of motivational interviewing and reflective questioning. So if someone is saying that, well, I don't want it, begin to unpack it. Don't just negate their feelings. Don't just say, no, oh, well, you're silly, you should go ahead and get it. No, begin to unpack the feelings associated with that. Say, okay, you're not ready today. That's fine. Well, what will it take to be ready? So when we talk about addressing vaccine hesitancy, it's about addressing what do you need in order to be ready to take it. And then when we were speaking about the second question, ensuring that people with disabilities and IDD providers have access to the vaccine. One of the individuals in my group, Leah, and you could definitely go ahead and unmute yourself, Leah, if you'd like. She spoke about how she has a child with autism and how going in and getting a vaccine for her son was kind of nerve-wracking and kind of challenging because of overstimulation. And so we spoke that ensuring that it is accessible for folks to get vaccinated in home should definitely be an option. And it should be a lot more easily accessible rather than calling up a bunch of places and getting heard no a bunch of times.
Yeah, and I just want to say, and I had also mentioned that Dr. Ginny Mantello was extremely instrumental in contacting the JCC, and they did a phenomenal job partnering together with Wagner. And my son went and had an extraordinarily positive experience where the staff there was very accommodating. So I know Dr. Ginny had also helped. I'd spoken in our breakout room of another friend who was looking for someone to come to the home, and Dr. Ginny really was a champion of trying to help make that happen. So I'm so grateful, again, from a personal level, for all of you behind the scenes working to make it happen. I do think that there needs to be more accommodations made for those that can't get out of the house, but really so far, I'm personally grateful for all that you have done. So thank you. Anisha, you're doing a great job recapping everything.
Thank you. And so something that Alea, what that conversation led to was just that ensuring that spaces to get vaccinated are accommodating as well. And something I believe either Megan or Jenny, you spoke to this, but focus groups to see and understand the needs of the community. So focus groups of individuals that are choosing not to get vaccinated. Okay, that's fine, but let me hear your concerns. Let me hear your concerns. Let me list out your concerns and let me provide facts and let me go to the larger community, to the larger administrative board and tell them your concerns so that we can figure out a way to make this process a lot more easier. So that was my group. If I miss anything, please go ahead and unmute yourself, guys.
Nisha, hi. Can I just make one comment? It's Dr. Jenny. Leah, thank you for those kind words. But what I do want to say is that things have really actually changed to our favor now. There's a lot more vaccine availability. There's also a lot more partners that, since not that many people are looking to get it, there's not as many people, as much of an sort of early on, we know that there were so many people looking, it was hard to get people, the vaccine, but now there are multiple pharmacy partners and others. We've actually connected with an agency called Care Tender, which they've agreed to come to Staten Island to do vaccines for homebound, and they're actually offering Moderna 2 doses as opposed to J&J. A lot of people, especially with younger, didn't want, younger individuals didn't want J&J. So we have Pfizer now that we can bring to the homes. Please don't hesitate to reach out, and I can send information for some of the pharmacy partners also. What I do is I try to just take the names of people that need the vaccine at home and then send it to the pharmacy partner, but I can connect people directly to the providers that'll do this as well. I just want to bring that up. It is definitely easier today than it was 2 or 3 months ago.
Perfect. Thank you, Dr. Ginny.
My pleasure.
And breakout room 2, if anyone wants to go ahead and share.
All right, I'll go ahead and share. So our group was a very dynamic group. That time went way too quickly, but we discussed, so we had Michael Weinberg and Fred Wetzel discussing what providers can do in navigating the impacts of the COVID-19 pandemic. So we did come up with a lot of calls for action, including be prepared now that we learned the first time. Let's get ready, God forbid. So having PPE on hand, as much info as possible, create an all-risk emergency plan, working together to see the bigger picture. Look at the, I'm sorry, it got a little small here, so I'm having some difficulty seeing. Looking at the congregate settings and the sizes of these settings and facilities for social distancing purposes. looking at the intersectionality that COVID had brought all of this to light. So let's talk about it. There are strength in numbers, so presenting a unified front to the community. Professionalism of the DSP, creating like a class for the DSP role, like the NADSP is doing. Ask for some feedback from DSPs and people supported of the positives that have come out of COVID-19. We want to look at teleservices as a whole for the future, because it's great for some people who enjoy it, but not everyone. Making it easy to understand to the community, learning how to navigate through isolation of people supported, and get health literacy information out. So holding focus groups, info sessions, and so on. By all means, Michael and Fred, if there's anything that I'm missing, please feel free to jump in.
Yeah, I just wanted to amplify a little bit on what we meant by strength in numbers. And that's that disabled people are not only isolated from the community as a whole, but they're also isolated from other people with disabilities. So perhaps, different groups of people with disabilities could work together to, as Michael put it, intersectionality, to, have a stronger front and, strength in numbers.
Thank you so much, Fred. So the second topic that we talked about was what can be in place to help IDD providers engage their staff to get vaccinated. So the first things first, let's promote the vaccine champions to remind people that the people that were supported are also in danger if you're not vaccinated. But we want to also be able to give enough info to make an educated decision without feeling like it's being pushed on staff. We're not mandating, but we are educating. We want to play up all the positives of getting the vaccine. It has been proven that people don't respond to fear, so let's be positive. We also want to promote mental health awareness because we are facing PTSD, the effects of post-isolation, grieving, losses of routine. We also discussed regularly scheduled forums so people can openly discuss their concerns, fears, kind of having open discussions like today. The racial balance among speakers at these forums and open discussions. Accessibility of vaccines is a big factor as well. Let's bring the vaccines to you. So now we're making it as easy for you as possible. And then we want to be able to provide something meaningful to staff. Maybe we can provide some incentives that mean a lot to DSPs. Let's get some input from them so it can make them feel valued.
Perfect. Thank you, Alyssa. And breakout room 3.
Hey everybody, this is Lucia Rossi. I didn't introduce myself earlier to the whole group. I'm the intake and benefits specialist at PCCS. I have long red hair, white skin, white background in my bedroom. I identify as she, her, hers. So I was the host of this lovely group with Dr. Ciasoko and Jill Cornell, among some other folks, who all contributed. Our group is pretty great with giving a lot of answers. As you can see, we definitely overfilled it a little bit, which is great. So how can providers do, what can providers do to prepare for the next wave or the next pandemic? So we have some different answers, like continuing protocols from last year, like safety, like wearing masks, washing hands, distancing, coming up with a report to give to congressional representatives, have the right contact information for clinical providers, having that emotional support options available, having an understanding of health disparities and different barriers that are local, and who can you go to for direction and recommendations, having that information, keeping telehealth options, completing post assessments to see how responses were so we can assess if things are working, advocating for funding like we always do, discuss the challenges so that we know what's going on, keeping up to date with that, partner with local agencies on projects, keep the projects going, spreading access and information, and having ongoing education, keeping up with the new data and studies that come out. So how can we support people with IDD and their families and providers with emergency preparedness? So we came up with like having a lot of different questions being answered for the preparedness, like knowing primary care providers, knowing resources, getting to know people in the community, know your medical conditions and risks beforehand, who is your health aid backup, having backups for everyone, encouraging families to advocate for themselves, have a written plan and sharing that with people support networks, knowing where you get your medications from, providing technology and communication strategies, knowing about the advanced warning system.nyc.gov, which gives notifications to share to providers for families and DSPs and stakeholders. We can use that. Having backups for emergency contacts, like I mentioned before, knowing what the closest hospitals and urgent care centers are. Again, like stressing the learning of health and safety protocols, and knowing where food options are, food access, the pantries, and having contact information for food supply.
Perfect. Thank you, Lucia.
Hey everybody, this is Alexa. So we had in our breakout room, Dr. Ginny joined us because Michael Cusick had to leave a bit early, but Chris will be bringing these to him, and we'll be putting all of this in a report to give out to everybody. So our first question was, where do legislators stand in getting the role/funding to support professionalizing the role of a DSP? So a couple of things that we realized we have to break down further is when we say professionalizing the role of a DSP, we have to really tailor out and be more specific around, we mean getting it created on a federal level, that there's a job code, having certification, allowing that certification to be tied to and recognized by providers to have difference in pay. We were also thinking about asking legislators, can you share with us what a DSP does from your perspective? Without having anyone on staff research it or look it up, what you know of what the role of a DSP is? Then we had two different points of data that we thought would be important to help give legislators backing and information for the advocacy that we need. So looking at, does any government offices have any listing of how many DSPs work on Staten Island, and can it be broken up then by different markers, for example, zip codes, race, ethnicity, religion, so that way we can understand our workforce better. This has been an ask from a lot of different providers to OPWDD and other agencies and government offices. And so we're hoping we can get something there. The second one was, can we get more specific data on how many people with disabilities are served on Staten Island, and then filter that out by people with intellectual or developmental disabilities, and then how many people receive support. Oh, sorry, I think the screen share stopped. I'm just gonna pull mine over here. The other thing that was talked about was thinking about petitioning or working with 1199 to see about unionizing for DSPs. And then our second question was, what will legislators do to advocate for increased funding for IDD providers? So some of the things that came up there, we're seeing about discretionary funding that could maybe support specifically the vaccine hesitancy and some of the work around vaccines. Potential funding opportunities for organizations that are referring people to get the vaccine, needing to bring more light to how funding for services and supports for people with intellectual and developmental disabilities actually impacts the community at large. So for example, thinking about how many people are accessing the rental subsidy programs and what's the economic impact of those rental subsidy programs? How many people are in the workforce and able to work because they have the support service of, let's say, Pathways to Employment or pre-vocational services? And then the last one was elevating some of the research around the impacts of service changes and staff turnover on people with IDD, their caregivers, and the profession as a whole.
Thank you, Alexa. Sorry, guys, my internet kind of dropped off over there. So as we
Nisha,
come,
if I could just add one point, and I think Alexa brought this up. So the city, the mayor announced this last week, and then they launched it this week. There's a new vaccine referral bonus program where community, now you can get incentives to community and faith-based organizations to help people get vaccinated. And community-based or faith-based organization can fill out a form if they want to participate. And for it's almost like a referral program. For every person that gets vaccinated with the first dose, they can actually pick the community-based organization that referred them. $100 will be awarded each time to that community-based organization. So let's say, for example, if there were vaccine champions within PCCS or any of the group homes that helped people register and get to their first appointment, and they put PCCS as their CBO, that made the referral. Each time, monies would go back to the community-based organization, and then this community-based organization can use that money to either continue to incentivize the champions or people that get vaccinated. So there's creative ways to then use the money, perhaps to give back, to your staff. I just wanted to add to that program.
perfect. Thank you. And just to really wrap up today's presentation, I know we're meeting time. A call for action. How can we best support individuals with IDD, IDD providers, caregivers, and families of individuals with IDD? And we do that, and we spoke about it heavily today by professionalizing the role of the DSP job title and working with our local legislators and to campaign for the disabled vote to ensure that disabled people's concerns are at the forefront of everyone's campaign. And more importantly, all the conversations, all the questions that were asked today, bring these conversations back home to your personal networks. So I just want to give a big thank you to PCCS and SIPPS. Thanks you for your participation in today's roundtable, and thank you to all of our panelists. And Chris, if you have anything you'd like to share before we hop off.
Yes, I wanted to thank you for this very unique roundtable. I love the way that it was broken out. We had so many experts, my colleagues. I'm so honored that they all came together here, to share, the information and knowledge and wisdom that they've learned over the year. I think this was so beneficial, and thank you to everyone who signed up and participated. I thought it was really just a great, afternoon to be on the call and share all this information. So thank you so much to the panelists, my colleagues for joining us. Thank you, Nisha and Alexa and Alyssa for putting this together. Lucia, thank you as well. And there's more to come, that's for sure. Thank you.
Again, this is the first of many. So if you guys have anything that you would like mentioned in our roundtables, please do not hesitate to let us know. And for anyone here that wanted CEU credits, I am dropping the survey in the chat. In order to receive the certificate, you have to fill those out. And with that, just a big thank you to all of our panelists and to all of our participants.
Thank you.
Thank you.
Thank you.
Of course. Have a good day, guys.
Thanks. Bye, everybody.
Thank you, everyone.
Bye.